and chronic disease management. May I call upon our experts to join the panel. Let me first start with Dr. Yogita Bhirud. She is the founder of Mindwell Homeopathy Diet and Yoga Clinic, where patient-centered healthcare is the priority. With a focus of holistic treatments combining homeopathy, nutrition, and yoga, located in Ghatkopar and Dombivli. Dr. Bhirud's expertise ensures an exceptional healthcare experience, promoting overall well-being through integrated care. I welcome Dr. Yogita Bhirud. Please come on the stage. Let me invite our next expert is Mr. Mandar Gadre. He is a PhD. Dr. Mandar Gadre is an IITian serial entrepreneur, a metabolic health consultant. As a founder of FitHolic Studio, he combines physical fitness with a focus on metabolic health to help individuals put chronic conditions into remissions. With a scientific approach, Mandar has successfully guided clients managing and reversing conditions like diabetes, hypertension, PCOD, and obesity. I welcome Dr. Mandar Gadre. Please come on the stage. Yes. Our next expertise, can we give a round of applause to Dr. Mandar Gadre as well? Yeah, everybody, yes. Yeah. Our next expertise is Dr. Richa Purohit. She is a seasoned physiotherapist with over 15 years of experience, holding a bachelor and master's in physiotherapy from Bhopal. She is a registered member of the Indian Association of Physiotherapists and a founder member of the Society of Physiotherapists in Pune. As a founder of Fitwell Physiotherapy, Dr. Richa specializes in pelvic floor rehabilitation and is actively involved in women's healthcare awareness campaign. More power to you. And our next expertise is Dr. Mahesh Sadashiv Adwarkar. Is a practitioner in naturopathy, yoga, and chiropractic. Dr. Mahesh his team has successfully treated over 25,000 patients using a holistic approach that includes massage therapy, cupping therapy, acupuncture, and various other natural treatments. The mission is to empower individuals to adopt healthier lifestyle and avoid ill through comprehensive natural health methods. So in this session, I welcome Dr. Sadashiv. Please come on the stage as well. Yes. And the session will be moderated by Lopamudra Das. She's a nutritionist and women's fitness specialist. May I invite her as well on the stage? Thank you so much for joining us. Yes. Thank you so much for joining us. As we all know that we started a bit late, okay, and the panel discussions are full of wisdom. So we have dedicated 30 minutes, 25 to 30 minutes for every panel discussion. And I have this beautiful gong, not to, so that it can be mesmerizing, it can be very hypnotic. So the moment I, ring this gong, I would like everybody to be aware that it's 25 minutes and we have last 5 minutes for conclusion. Okay? So over to you, Lopamudra.
Hi, everyone. Good morning. How is Saturday treating you? All good? So everyone is looking beautiful, gorgeous, shining. And today we are talking about health. So I think looking good, fit, energized is a part and parcel of health. So yes, I'll make some space for you. So why I'm saying that you all are looking good, I'm also looking good, right? Say please, yes. So I believe in affirmations, and I believe that when we want to bring some changes, we start believing that we already are. So with that note, I'll start today's this insightful panel discussion about preventive measures, preventive healthcare, and how these chronic diseases can be treated, chronic disease management. So with that note, I will just want to bring that note because this chronic diseases like diabetes, obesity, heart diseases. We used to know earlier that it comes to diabetes especially, that it will come after 50, 60, we are fine, we are in our 20s, 30s, 40s, we are good. But unfortunately, this is not the case right now. I started knowing about juvenile diabetes, obesity starts from very early stages. So it's very alarming that how it starts so early. So I would like to know about all the experts today that how we can prevent these chronic diseases with your expertise, with your strategy, then we can discuss and know more about it. So I'll start with today's first question, open to all. This preventive healthcare has come a major focus in reducing the burden of chronic diseases. In your expertise, what role do you think that lifestyle changes and early prevention and this proactive healthcare can prevent this and we can keep it in our mind? So I'll start with Richa.
Yes, thank you, and a very warm welcome, everyone. Hello. Definitely, preventive healthcare has a major role in your overall health improvement. I am a physiotherapist. I call myself a movement specialist because I basically work on your movements. Movement is something which is the best thing to make you healthy. Coming to the preventive healthcare, definitely if you are aware of your own health, if you know that you will be, for example, as she mentioned, Lupa mentioned that diabetes is a chronic disease. Yes, it comes from heredity as well. So if you know that you have a family history and if you are aware of certain things, you can work on your lifestyle changes, you can delay or you can prevent yourself from that particular disease. If you are an office employee, if you have a sedentary lifestyle, you are prone of getting n number of health issues. So if you are aware and if you can change your lifestyle, if you can change your food habits, your activity level, you will definitely can lead a better life. The third part is education. Education, it means the self-awareness part. So definitely preventive healthcare, and as a physio, we call it preventive physiotherapy. There is a myth that people feel that physiotherapy is needed only if you are sick, only if you have pain. But no, the latest concept is preventive physiotherapy. Preventive physiotherapy will definitely help you leading a better life. If you're into sports, if you're into any activity, we will do the assessment. We find out what is your body requirement, and accordingly we prepare your body to not to get injured. So again, prevention is better than cure. So better so if you are injured, if you are suffering, you will have to spend more. So please be in your budget and work on your preventive health. Thank you.
So what do you think, Ms. Richa? Now you can probably say that what are the approaches we should take care firstly?
First thing is definitely a good lifestyle, having a healthy lifestyle, good eating habits, exercising, keep moving. I am a certified ergonomist, and as an ergonomist, I take n number of corporate health talks, and I feel very disappointed when I see people, the employees who are into mid-20s, mid-30s, they are having back pain, neck pain, slip disc issues. That is very disappointing because
we feel younger to them.
Exactly. So yes, my advice to them is please stay healthy, stay fit. It's not that you have to go to gym every day. You have to lift 50 kgs every day. It doesn't matter. You just have to be active, stay fit, stay healthy. That is my advice to them.
So, being a homeopath doctor and a yoga therapist, so I always seen in the preventive. When we say preventive, it's not like with one or two things we can prevent all the things. It overalls your immunity. So immunity builds with the 5 things. First one is the good diet, good sleep, good thoughts, then exercise, and the last part, when you are getting ill, then what medicines you prefer. So if you're preferring all these medicines which increase your immunity and combining all these 4 points together, then definitely the preventive health will come together automatically. With the working lifestyle right now and the way we are working all the day with the stress and with the thoughts, with the fast life routine, obviously all these changes are very necessary to maintain the preventive measures. Second thing, when we go to the preventive, it's a maintenance part. It's not like you do only one time and it gets covered. It's like all the time you have to keep covering and you have to focusing on it. So how you will increase the awareness of your body, then there yoga always comes into it and it helps into it, making your mind aware. So all these things definitely helps into the preventive part and you have to maintain it.
So if you can put some inputs from your side.
Okay. Hello, मैं डॉक्टर महेश अडोलकर, नेचुरोपैथी एंड कायरोप्रैक्टर. एक्चुअली प्रिवेशन में क्या है, नेचुरोपैथी में लोगों को लगता है कच्चा खाना, कच्चा पीना, यही सब नेचुरोपैथी है. एक्चुअली वैसा नहीं है, उसमें भी काफ़ी है. आप योगा करते हैं, डाइट मेंटेन करते हैं, टाइम पे खाते हैं, टाइम पे सोते हैं, तो भी आप उसमें काफ़ी प्रिवेशन ले सकते हैं, उसमें भी आपको काफ़ी इम्प्रूवमेंट हो सकती है। अभी क्या हो रहा है, हम टाइम पे नहीं खा रहे हैं, टाइम पे नहीं सो रहे हैं, जो खा रहे हैं वो सब ऐसा ही खा रहे हैं, वो सब उसके ऊपर हम ध्यान देते हैं तो भी काफ़ी हमें हेल्प हो जाती है उसमें।
Can be as a preventive measures they should start with it.
It's your lifestyle ना, you
Right.
take a lifestyle, eat healthily, do exercise every day. It's a good.
Everybody faces
Yes.
this doing
Yes.
workout every day. It's a
Yes.
tough job. I know.
So when I think of lifestyle changes for prevention, right? So first thing I usually help people understand is that all of these chronic lifestyle diseases, they have their solution in the name itself. They have happened across decades, and we have ignored some fundamental aspects of our health, and that is why they have occurred. So we have to sort of go back to those roots, understand those building blocks of our health, and then work on those. And as the other panelists have said, this is going to be a work in progress, right? We cannot let it go, right? So we have
It's
to
not a one-day job.
Absolutely. So it's all about finding the key where we have lost it. Not because it's not hidden in some bottle of pills. It's truly there in the lifestyle. So we need to go to the root causes. And when I work as a metabolic health consultant, we help people understand the core of metabolic health, which impacts all aspects of our well-being. And that's how I look at it.
My next question is for you, Yogita. As a homeopathic doctor, homeopathy is important in preventive.
I would like to say that homeopathy is not only the preventive, but it's curative as well. So when I go into the chronic disease, the chronic disease doesn't develop in a very shorter duration. It always with a longer duration, and it's present in the body since so long. When I say the homeopathy, how it will help into it, then homeopathy has an aspect which is working on the mental level, physical level, and spiritual level. So now if you see into the chronic disease is having two types of, like, one is the completely reversible and the second one is irreversible. So when we go to the reversible, then homeopathy has a fully potential to come to the reverse the disease and make completely cure with the root cause itself. But when we go to the irreversible pattern, then in that case, we always need to take with the conventional medicines, where it comes role with the combined therapy. So with the combined therapy here, there always be a need that which medicines are required to control the disease will require that medicines, but in that situation, when the side effects get much more and the generals are getting worsening, then again there is a role of homeopathy which works on the mind level also, and it helps to patient to overcome from the chronic diseases. When we say like the diabetes, asthma, and the chronically severely where the gross pathology is already developed, and then patient comes to the homeopathy, then it's a very challenging job. There you cannot leave the even conventional medicines, neither you can leave the homeopathic medicines. There it's a completely equal and 50-50% rule, and then you can slowly reverse, not completely reverse, but I can say you can increase the much better level of health. So in the level of health, when you see that you need to maintain the vital energy of the patient, it is like you can be a grossly severe pathological ill, but if your vitality is good, then you can overcome that disease very easily. So here again, the homeopathy has a role that it works on the spiritual aspect as well, and it completely cures the whole aspect. Like many medicines are based on the behavioral pattern also. Like in a particular disease, if the patient's behavior is different, then the medicine is get completely changed, even though the disease name is similar. So this kind of approach always I combine in my clinic, and I help in the chronic diseases to all my patients.
Yogita, so if my question is, do you use any innovative or any technology to help the patients, or do you suggest anything which can be implemented?
In the technologically, if I say that there are certain fitness apps, like they can monitor the heart rate, then we can use that in the emergency level, pulse rate and all. But apart from that, now it's a digital and global platform is there. So I personally have set up my own mobile applications for my patients and the patients who are not in India. So I handle all these patients from that platform, and I easily get connect with them because in homeopathy, like many medicines are already we can give to the patients before even the diagnosis of the particular disease. Like, because earlier I said that it works on the completely pure symptom similarity basis. And then later on, definitely we also need a diagnostic. It's not like that we never do a diagnosis, but we can start medications and we don't need to wait for the diagnosis. It's like on the behavior and the symptom based, we can immediately start the medicines. Not sometime, but every time it's like the technological, when we say ki without technology now, it is even not homeopathy is working, because the repertorization base, the case taking base, and the whole materia medica is base. It's like we need to rely on the softwares, because without that we can't completely go into the classical homeopathy. But of course, when there are acute cases, we don't need to completely depend on the softwares, because it's the knowledge which we have developed in our practice where we can immediately identify the medicines, which medicines we have to give. So it's not 100% technology, it's experience with technology.
Doesn't matter how much AI is here, how much machinery things are here, but still human intervention, nothing can replace it completely. Thank you so much,
Right.
Dr. Yogita. It was very insightful for me. My next question is, Dr. Mandar, to you. So diet and exercise are often considered as pillar of our health. So in your experience, what do you think is the biggest misconception people still have dealing with these chronic diseases?
Right. I think the biggest misconception is that you can outrun a bad diet. This I say as somebody who runs a fitness studio, runs a gym. But we have been sort of told that whatever has gone wrong for our internal health, for our metabolic health, right, can be compensated by doing more exercise. So whenever diabetics come to me, or people suffering from PCOD, fatty liver, or even obesity, they come to me, I help them understand that the open secret in our industry is, for these types of conditions, more exercise is not the main answer. It of course helps, but it's not the main answer. So I sort of look at it as having twins in your house. If one is hungry, you cannot feed the other twin more food, right? So if it is gone wrong in terms of your internal health, then that's where it needs to be fixed. And if it is going wrong in terms of your physical fitness, so if you are getting, back pain, neck pains, as we were discussing, or if you are not able to complete some simple physical tasks in your day, of course your fitness is what is missing. So just a clean diet is not going to help you. That arrow people understand, but the reverse they may not understand. So that I think is the biggest misconception. The second minor one is that we have also accepted the deterioration of our health very, very quickly. I mean, in your TV serials and movies, when they want to show that some elderly person is getting taken care of, all they really show is the youngsters in the house are giving them medicines on time, right? Nothing else. So we have to really ask that why are these medicines being required for years and years? If they are required for a short time, that's fine. So that's the other misconception, that because you're advancing in age, this is going to happen. That's an absolute misconception. So I think those are the two big ones. And thirdly, of course, we are not really hitting at the root cause, but we can discuss about that.
In a sustainable way, what do you give advice, and somebody probably never into workout or never into any proper routine, so what you can suggest?
Absolutely.
That's sustainable for anybody?
Right. So see, we have been categorizing the advice that we get in two buckets, right? Either I find this advice as sustainable and this advice as not sustainable. So that is happening because somebody else is giving us a plan. Okay, so when either people are getting some workout chart or diet chart or whatever, right? So that plan is not being developed with that person's participation. So what I do is that I remain only as a guide, and then I help that person develop an actual lifestyle plan by working with them for several weeks or several months. And when they have developed the plan, that is going to stay. Otherwise, if I give them a piece of paper that can go on their refrigerator, and very soon it's going to fall into the trash bin, right? So sustainability will come only if you have developed the plan. I am there to help you do it, but you know the constraints of your life and your household much better than I do. And also we have to realize that we have to compare correctly. So which means that if people say, okay, this is not sustainable to me, the comparison is not with some, hypothetical third way out, which will also let me do whatever I want, but also not make me sick. That doesn't exist. So the real comparison is with a chronic disease, and so those costs need to be compared correctly. When people compare them correctly, they find that many of these things suddenly become sustainable.
Is look for the motivation from doctors and I guess more than motivation, if it comes from inside that I have to make some changes, then it is really, really sustainable. Motivation doesn't really work very well for the longer run. What do you think, doctor?
So as I was saying, motivation will work, right? Because for somebody who has been suffering from diabetes or weight gain or PCOD and all of that, right? They have to wake up one day and compare that journey of 15, 20 years.
Right.
Then, so I cannot, implant that motivation in somebody's head. They have to look around and realize that our hospitals are right now full of people. 90% of them are all chronic conditions. So that's the major load. And tomorrow I'm going to land up there, right? So I think the motivation has to come from within. People like us can only help sort of nudge somebody else.
So my next question for you, Dr. Richa. As a physiotherapist, you work closely with patients who are recovering from any sort of injury or any sort of accident that happened earlier. So how do you see physiotherapy playing a preventive in managing those chronic diseases? What are your inputs into this?
Yes, definitely. So physiotherapy starts when a child is born. Even a premature baby, having respiratory issues, having delayed milestones once he or she starts to grow up. Physiotherapy plays a major role. Excellent recovery we have seen. So definitely, we cannot stop or we cannot delay the premature birth. If the child is born and if we know that these issues might definitely trouble the child, then we start working on the child immediately, giving them some respiratory measures of physiotherapy interventions. We have respiratory physiotherapists. So physiotherapy has different branches. It's not that we only treat pain. It's not that we only prevent injuries. We have cardiorespiratory physiotherapists, we have pediatric physiotherapists, sports physiotherapists, gynecological physiotherapists. So we all are working in specific fields to prevent the injuries first. But if the injury has happened, we will treat the injuries. Coming to the teenager girls having menstrual issues, having then the pregnancy-related issues in women, then perimenopausal issues in elders, and then again in elderly people, geriatric care we do. In case of preventive physiotherapy, first we advise people to have how the diagnostic people do, how the pathology labs, what we do, we have a plan that every year we'll do a health checkup. So in preventive physiotherapy also, we advise people to have preventive health checkups with under a qualified physiotherapist. We do the proper assessment of the person. We do assess the requirement, the body requirement. We check the entire history, the family history, their lifestyle history, and then accordingly we customize the protocol, customize the plan. It's not that one exercise suits all. It's not that one size fits all. So every individual has a different need, a different requirement. So accordingly we customize their protocol, we customize their lifestyle habits and the exercises, and that is how we work, and we are getting great results in all these preventive measures.
Thank you so much. My next, just a question to my point of view, that what are the strategies you will suggest if I really want to pinpoint that, okay, these are the strategies somebody can really use?
Yes, while I was listening to Dr. Yogita, I'm really glad that she is of the same mindset what I am with, that all these AI apps, the latest technologies, they are not worth it. Our hands are magical. God has given us those skills, that knowledge, that power, that we can do the assessment better than the AI apps and everything. So no matter technology, jitna bhi aage badh jaye, is really hats off to the technology, but our knowledge and our skills are far more better. So yes, we do use some posture analysis apps, but it is for the clients who are not able to visit. I prefer them to do meet me at least once. Just let me check their body, let me check do their assessment. Then what I do personally in my clinics, we give them a treatment protocol, we give them few sessions. After that, we have an online support program going on. In that online support, now we know that particular person, we know their individual complaints and their needs. Then we put them into the online exercise programs, and we have made a protocol of 6 to 8 weeks of that exercise protocol. Mostly the major group of people, they fit into one or the other exercise program, and that way we make sure and we believe that if you are doing exercises for 6 weeks continuously under our guidance, you will do it lifetime. Because
That's amazing.
there is a particular time period, right, when the body adapts, then the body demands to work on your own self. So that exercise protocol which we have been using is really working wonderful, and it is working for all age groups and for almost all the conditions.
That's beautiful. So do you have any tip for the daily posture that we all screw up almost, I think?
Yes.
That I get to hear many, almost every day that, okay, wrong posture. So do you have any quick tip for all of us that we can follow?
Yes, so I can see people sitting here and I don't see anyone sitting in a good posture. So if you're sitting, please make sure your spine is in a good curve. Never imagine that the spine is straight. The spine is not straight. The spine is curved. So you have to maintain the curves of your spine. If you're working if you're an office employee, you have to make sure that you're supporting your lower back curve with a small cushion or a small pillow. Then you have to look straight. If you're working on a screen or desktop, make sure the screen is at the eye level. Generally what people do, the screen is at this level, they are working continuously in this position. That's going to hurt your spine. The body is meant to be balanced. We are imbalancing it by our poor posture. So maintain a good posture and take frequent breaks. ज़्यादातर patients आते हैं, they are like 2 घंटे 3 घंटे में हम break लेते हैं. We suggest 45 minutes. Set alarms. Take breaks after every 45 minutes. If you're not able to walk around, just sit and fool your body that you're exercising. Just move. And I'm sure that will help you. Thank you.
Even when you are watching Netflix, make sure after each episode you take a break.
Yeah.
Thank you so much. Thank you so much, doctor. So talking about when we mix and correct blend of machine and human touch, talking about with that points, I'll go to Dr. Mahesh, that your correct blend and increasing demand of integration of approaches combining modern techniques and our old methodologies. So what are your inputs to prevent chronic diseases with your expertise into this?
एक्चुअली बहुत लोगों को नेचुरोपैथी क्या है यही पता नहीं है पहले.
Even me too. I want to know more.
इनमें से भी काफ़ी लोगों को पता नहीं होगा. कितनों को पता है नेचुरोपैथी क्या है? हार्डली 2-3 लोग हैं. वही तो होता है. नेचुरोपैथी में मेन क्या रहता है, रूट कॉज ऑफ द डिसीज दिखते हैं. और नेचुरोपैथी में मेन हम क्या बेसिक प्रिंसिपल क्या है, हमारी बॉडी जो है पृथ्वी, आप, तेज, वायु, आकाश, इन पंचमहाभूतों से बनी है. जब भी आपको कुछ बीमारी होती है, आप उन्हीं के सानिध्य में फिर से जाते हैं तो आपकी बीमारी ऑटोमेटिकली कवर हो जाती है. अपना ही बॉडी जो खुद की, हम जितना हम डॉक्टर है खुद की बॉडी का, दूसरे कोई डॉक्टर नहीं है. जितना आप आपके बॉडी को समझ सकते हैं, दूसरे डॉक्टर कोई नहीं समझ सकते. मॉडर्न मेडिसिन में क्या होता है या मॉडर्न टेक्निक में क्या होता है, आपको एसिडिटी हो रही है. मैं सिंपल एग्जाम बता देता हूँ. एसिडिटी हो रही है, हम सोचते नहीं कि क्यों हो रही है. मैंने कुछ गलत खाया है, मैंने रात को लेट खाना खाया है, लेट में सोया हूँ. ऊपर हम सुबह उठ के क्या करते हैं, एक ओमेज ले लेते हैं, काम पे जाते हैं. एक्चुअली वो एसिड रिफ्लेक्ट होता है, वो बाहर निकलना चाहिए, पर हम नहीं निकालते, उसको अंदर दबा देते हैं. नेचुरोपैथी में हम वही बोलते हैं, उसको नेचुरल प्रोसेस है, ये निकलना चाहिए. आपको कॉन्स्टिपेशन है, हम ध्यान नहीं देते, हर रोज़ कुछ ना कुछ खाते रहते हैं, वही आगे जाके पाइल्स में हो जाता है, कन्वर्ट हो जाता है. यही बेसिक चीज़ें रहती है. कोई भी बीमारी हमें ऐसी ही नहीं आती, उसके हमें पहले सिम्टम मिल जाते हैं. उस सिम्टम के ऊपर हम काम करते हैं ना, तो क्रोनिक बीमारी आती नहीं है. इसलिए इसमें प्रिवेंशन बहुत इम्पोर्टेंट है. तो हम वही सजेस्ट करते हैं लोगों को, आप छोटी छोटी चीज़ों को आप इग्नोर मत करो. उसे उसी टाइम पे आप ट्रीटमेंट लेते या कुछ करते, आगे जाके कुछ आपको ट्रीटमेंट लेने की ज़रूरत नहीं पड़ती। और नेचुरोपैथी में ट्रीटमेंट नहीं रहती है, सिर्फ आपकी लाइफस्टाइल हम चेंज कर देते हैं।
एब्सोल्युटली। सो आप हम लोगों को कोई एक सिंपल सा एग्जांपल जो आप पेशेंट को आपने इम्प्लीमेंट किया है, बोथ द टेक्निक्स जो उन लोगों को बहुत हेल्प किया, ऐसा कोई अगर हम लोगों को एग्जांपल दे पाए?
एग्जांपल इसमें पहले मैंने बोला आपको, एक तो एक्सरसाइज चाहिए। एक्सरसाइज कोई भी करो, जिम करो, योगा करो, कार्डियक करो आप, या फिर अपना ये कुछ भी आपको स्विमिंग करो, हर रोज़ डेली एक्सरसाइज होनी चाहिए। दूसरी चीज़ आपका खाना टाइम पे चाहिए, मॉर्निंग जो भी है आपका ब्रेकफास्ट का टाइम, और हर रोज़ खाने में आपको ग्रीन सलाद चाहिए, ग्रीन वेजिटेबल चाहिए, वो आप लेते हैं तो आपको काफ़ी इम्प्रूवमेंट हो जाता है।
और टाइम पे सोना कितना इम्पोर्टेंट है व्हेन यू टॉक अबाउट एसिडिटी?
बहुत इम्पोर्टेंट है। एक्चुअली कैसा है, रात को पहले हम 8 बजे खाना खा के सोते थे, अभी 12-1 बजे लोग सोते हैं। और दूसरी चीज़, रात का खाना और आपकी नींद, उसके बीच में कम से कम 3 आवर का गैप होना चाहिए। जनरली लोग 11 बजे खाते, 11:30 को लुढ़क जाते हैं, वैसा नहीं होना चाहिए। और अर्ली मॉर्निंग सुबह 6 o'clock उठना ही चाहिए।
सो डॉक्टर, आप जब उनको ट्रीट करते हो, कितना आपका मेंटल जो हेल्थ हम लोग बोलते हैं और एसिडिटी, कितना वो लिंक है?
बहुत बहुत कोई भी बीमारी हो, आपका खाना, आपका टाइम पे सोना, आपकी लाइफस्टाइल, उसके ऊपर डिपेंड है। जनरली मैंने वही बोला, हम नेचुरोपैथी में क्या सिखाते हैं लोगों को, आपकी लाइफस्टाइल चेंज कर देते हैं। अभी सर बैठे ऐसे टेढ़े बैठे, अचानक उनको करवा जाएगा या पॉकेट रखा होगा।
सो ही विल कांटेक्ट रिचा देन।
आपने पॉकेट रखा है ना पीछे, पॉकेट रखा है ना पीछे, ऐसे रखते तो फिर साइट का प्रॉब्लम आ जाएगा आगे जाके। मैम को भी पता है, वो पोस्चर करेक्ट नहीं ना, ठीक से बैठना चाहिए। हर रोज़ कुछ ना हो तो कम से कम 10 सूर्य नमस्कार आप डालिए, आपको कुछ नहीं होगा। एक्स्ट्रा कुछ एक एक्टिविटी करने की भी ज़रूरत नहीं है।
तो आपको आपकी तरफ से
बोलते हैं हमें टाइम नहीं है, बहुत आपका बिजी शेड्यूल है, 10 सूर्य नमस्कार डालने के लिए 10 मिनट लगते हैं, 1 सूर्य नमस्कार 1 मिनट में हो जाता है। उतना भी आप करते हैं ना तो भी काफ़ी है उसमें।
Right. Thank you so much, Doctor. It's wonderful insight from you. Any question from our team, our audience? Do you want to ask any question from our experts?
Maybe I'd like to ask one question, Dr. Richa, that in the corporate world today, we see, or in manufacturing, mainly in the management job, a lot of life is sedentary. You sit, you work. Okay, what kind of basic exercises that you would recommend? Maybe because you do a lot of corporate programs, I've seen that. I've spoken to you personally as well. So anything that you want to share, show, would be great for us, to everyone.
I would like to demonstrate rather than speaking.
Excellent, excellent. Yeah.
Okay, so for corporate people, I always listen from the people that we are not getting time. We're continuously in calls, right? 2-2 घंटे के calls चल रहे हैं. How to do exercise? What to do? You know, or we are in the office. We are not ready to exercise in front of our colleagues. We can just go. We can have tea or a coffee or a water, and we'll come back. We'll sit. So my advice to them is always you can do desk exercises. Come in groups. Ask your friends to join you, ask your partners, and then you can sit together, do some desk exercises. So I have personally designed some desk exercises for the corporate employees. I can demonstrate if ma'am you can help me. That would be great if you all can join us in this desk exercise. That way you'll remember also next time when you are working, after 45 minutes break, you can do this. So it's not that after every 45 minutes you will have to repeat these desk exercises. In one break, you can go for a washroom break. The second break, go have some tea, coffee. Third break, make sure you're exercising. Fourth break, again, you go for a walk. Fifth break, anything else. Sixth break, again, exercise. So at least make sure that 2 breaks you are doing these desk exercises. So if you all can join me, I would be really glad. So my focus is in breathing patterns. What generally people are missing is they don't breathe when they exercise. Breathe as in they tend to hold their breath when they're exercising. For example, if they are doing any stretching, they will do the stretch, they'll hold their breath, they'll hold the movement, and they'll release. It makes no sense. Your body needs oxygen. So please keep breathing. So just follow my instructions and do these few exercises I'll explain.
Thank you, Rachel.
So the first one is, you just have to sit straight. Again, sit straight doesn't mean sit straight because the spine is curved. So make sure that you have a good support at your back or the spine is curved. Just take a deep breath, close your eyes, just focus. Close your eyes, take a deep breath through your nose, breathe out through your mouth. So, we will repeat. Breathe in, breathe out. Next time when we breathe in, you have to imagine that you are moving. So, not imagine, like you have to move. So, just hold your arms. You have to breathe in, relax your body. You have to breathe out, bring your arms up. Try to move your body up, stretch your body up as much as you can. Breathe in and you have to relax. We are not holding it. So just understand the instructions. Breathe in, relax your body. Breathe out, pull yourself up, stretch yourself up, feel taller as much as you can. Breathe in and relax. We will repeat. This time we will hold. So breathe in, relax, breathe out. Now hold the movement. Breathe in, breathe out, breathe in, breathe out, breathe in and release. So this is just an example of how we do. Because generally if you'll stretch, you'll hold the breath. So you have to make sure you're not holding the breath. So this is one example. Other example, just do simple neck movements. Five movements in all the directions are sufficient. So front and back, side movements, side bends, and half rotations front, half rotations back. Coming to the shoulder, quick shoulder rolls. 5 shoulder rolls front, 5 shoulder rolls back, and relax. Coming to the upper body, so just hold your arms in this way, just twist, back, twist, back. Remember the breathing pattern. Breathe in, relax, breathe out, move, breathe in. Breathe out, move, breathe in. 5 repetitions are more than enough. Bring one hand up. We are working on the breathing muscles now, because if you are in a bad posture, your breathing muscles are compromised. You will not be able to breathe good. So, hand up, breathe in, relax, breathe out. Bend on your side. You should feel the stretch in the intercostal muscles, which are the breathing muscles here. Breathe in and relax. Same 5 repetitions. 5 repetitions on the other side. Breathe in, relax, breathe out. Stretch yourself. Breathe in and relax. Coming to the lower body. So, just spinal twists we do. Coming to the hip joint, quick march. Sit and march. Just sit and march. Coming to the knee, just knee bend and knee straight. Ankle toe movements. You're done with your full body exercise.
Can I add something? Yeah. So when you are on a screen, it's a 10 by 10 rule. 10 seconds you will see the screen and 10 seconds you will see outside. Again 10 seconds screen and 10 seconds outside.
Yes, that's the eye exercise. Yes, eyes do need stretches. Full body ka tum stretch kar lete. What about the eye muscle?
Yeah.
So in order to avoid the strain to your eye, we call it 20-20-20 rule. After every 20 minutes, take the eyes off the screen, look at something 20 feet far for 10 seconds as ma'am mentioned. Relax, repeat, relax. You will never get strain in your eyes, and because of the strain in your eyes, sometimes we get headache, neck pain. So I'm sure you'll be free from all these things if you'll follow these simple tips.
Thank you so much, Dr. Richa. It really helpful. Dr. Yogita, I have my one personal question to you. So in the time of, we all want very fast inputs, fast results every time, everything wants instant coffee type. So in this time, how do you keep the patience in your patients, that homeopathy?
That's a very wonderful question. Yeah. But again, it's a knowledge and awareness. So ideally the word fast itself is a wrong word. There is nothing fast results. It always slow is the fast. Whatever the slow, it is always the fast. So we actually had the wrong concept and myth that we have carried out. The same way yoga also supports it, and same way homeopathy is also supports it, and all other alternative paths like naturopathy. These I cannot say it's an alternative, it's a mainstream actually. We have made it alternative. So the way, like, as also I said earlier also, the how we manage our illness is the prime importance role in our health. From the childbirth to the old age. It's not about only diet, it's not about only sleep, only exercise, it's the thoughts also and the medicines which you take all the time. If you take the medicines which enhance your immunity, you will definitely reduce the chronic diseases in your lifestyle. And once you go into chronic, there is like, to come back, it's very difficult and challenging. That is the maintenance. So again, it comes under into maintenance where the patient gets tired to do the medications all the time. So prevention with the cure, it's all combining together. And there, to keep this awareness, the patient ko lana, it is the difficult challenge. But once they realize that here is not a fast terminology exists, hai hi nahi, there is no terminology of the fast. It is always slow is the fast. Same for the study, same for your career, or same for your finance also. And for everything, it is slow is the fast.
Because sometimes I say this to my clients that I don't cook Maggie, that you will 2 minutes result. So it needs dedication, it needs some perseverance to see the inputs. And yes, that's why I really personally wanted to ask this question from the time I met you.
Yeah, thank you.
Thank you so much. Thank you so much. And with that note, I would say that there is no fast result, and prevention is actually the cure. Prevention is better than cure. And when we can prevent all those chronic diseases like diabetes, heart diseases, obesity with our little lifestyle changes, not too big, one day at a time, and implementing those steps will really make a great result in your health. Thank you so much, all of you, and your expertises. I hope that will help everyone today. Thank you so much.
Thank you for the Pierman and Hudson that they have given us the platform.
Absolutely.
And for the listener also, those who are listening to us very patiently. So thank you so much.
Thank you so much once again, and may I request everybody, the Pearson Hardman team, to get us a Tulsi plant so that it signifies healthy life leading to a healthy nation.
Thank you, Paris.